Good morning. Good morning. Good morning. Good morning. How are you? How's everything going? Hopefully everything is going well. Um I don't understand. My co-host is texting me. I see the dots. Oh, okay. One moment, please. Gather your tea. Get your tea. Get your tea together. Get your cups together. All right. All right. All right. Hold on. Let me see. I hope this works. Use more. All right. All right. All right. All right. I think we're ready. He's coming in. But anyway, how are you? How's it going? We can go ahead and get this party started. So welcome to the Saturday morning tea where we do all kinds of things. We discuss health information, news, education, certification tips, entrepreneurship, really the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button. You know, over here, we brew all the hottest tea in healthcare. And boy, have there been some tea spilled this week. Yes. So I am Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, specializing in revenue cycle and regulatory compliance and education. And let me ask you, do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, whenever he gets in, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, 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 hey. All right, all right. So, if you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. Hi, let's see who we have in the house. Good morning. Good morning. Welcome, welcome. All right, all right. I'm still looking. I don't see. Good morning. Good morning. How are you? Crafty coder or on the street correspondent in the house? In the house. Okay. So before we jump in, let me remind you that you can join in and add to the conversation. Don't be shy. Oh, I'm not at, well, she said, I see the sunshine. Yes, I'm in warm and balmy Macon, Georgia. How about that? Because it's freezing in Cincinnati. I'm traveling. I'm traveling. All right. So, again, before we jump in, let me remind you that you can join and add to the conversation. It's welcomed here. Don't be shy. You and your opinion matters and is welcomed here. Always, always. Even if you are contrary to the topic at hand or the popular opinion, even if you are sharing an unpopular opinion, how about that? It's still welcome here. So use the chat. And if you have a question, please type Q first. So I know it's a question and question for me and us, and we don't miss it as you chat amongst yourselves, because you know y'all like to do that as well. So for those who are just joining us or watching the replay, today we are talking AI ethics, the new HIM frontier. Good morning, Tanika. Good morning. Good morning. Welcome, welcome. Yeah, and you can don't be shy. You can come on in the room. You know, we were taught when you walk into a room, you speak, right? So come on in the room and say hi. Some of those manners, I don't know. Sometimes I'm looking at some of our folks like, you ain't gonna speak, you ain't gonna say nothing. Absolutely nothing. Okay, that's what we doing. That's how you was raised. All right. Anyway, so let's get into our church announcements, shall we? Yes, so soothing. All right, all right. They was really hitting it there. Hey, hey, hey. Okay. So, two announcements. The first one, I believe this came from our on the street correspondent. I believe, where we talked about Anthem, Blue Cross and Blue Shield, and how they were going to put a cap on anesthesia coverage. And I'm chuckling because I saw so many memes and videos, and the one in particular, it was this guy that was he was acting as the patient and the doctor, or the patient and the anesthesiologist. And so the patient was having some sort of procedure, and he woke up. And so the anesthesiologist is like, hey, we're at the end of your anesthesia where the payment stops, and you got two choices. I can give you another dose of this for, I think it was like $4,500, or I can give you 10 more minutes for $900. And he was like, we take all kind of payment. And he was going on and on and on. And dude was like, what? And so he was trying to explain to him, how his insurance doesn't cover for full anesthesia, blah, 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 blah. And it was just a parody on all things craziness, because this was truly crazy. But what has happened is they are rolling back that plan. And I guess, I don't know if that's indefinitely or is it at least for now, because the backlash that they received was so intense that it has been decided that their new policy that they were implementing, they are rolling it back. And so Elevance Health, which recently rebranded from Anthem Blue Cross and Blue Shield, again, first shared this information about this proposed change for Connecticut, New York, and Missouri via news press releases that were posted on November 1st. And, again, if you're not into the healthcare realm, particularly around insurance coverage and payment and that type of thing, it may not have hit your inbox. It may not have hit, your feeds or reels or any of those things. So this has been slowly trickling out. And then in some instances, provider notices were sent to specific states just recently, as of December 1st, which may have also contributed to the delayed reaction to that. But the public backlash was fierce and swift. And it says, according to a description of the policy on Anthem's website, billing guidelines would change in some states beginning February 2025 to cap the amount of anesthesia care the company would cover based on time limits preset by the insurer. This means that if a patient's procedure ran long, the insurer would not pay for the care. And the American Society of Anesthesiologists said in a statement posted last month calling for the move to be reversed. The proposition concerned not only members of the public who began making tongue-in-cheek comments online and videos about being woken up mid-surgery to swipe a credit card, but professional organizations, doctors, and lawmakers alike. So late Thursday afternoon, Anthem shared a statement with USA Today announcing the decision not to move forward with the change. They stated there has been significant widespread misinformation about an update to our anesthesia policy. As a result, we have decided not to proceed with this policy change. To be clear, it never was and never will be the policy of Anthem Blue Cross and Blue Shield to not pay for medically necessary anesthesia services. The proposed update to the policy was only designed to clarify the appropriateness of anesthesia consistent with well-established clinical guidelines. So the news came, no, that was it. Okay. So that was one of our church announcements. They are walking that policy back. Again, I don't know if this is an indefinite walk back of the policy, or is it something that they are temporarily going to walk back? They did not necessarily say. Yeah, clarify, right? Because there was I'm just reading y'all what the press has reported, and that came from USA Today. She said PR should have done a better job. Absolutely. And made sure that when they put the information out, that it was timely, that it was clear, that was accurate, all of the things. So yeah, somebody job or two might be on the line as a result of this as well. So craziness, foolishness. But then girl, you said it right there. Walk back in public and deny in private. Because according to all of the information that I have been seeing of late, denials are truly on the rise. Folks have been getting denied more than they have ever gotten denied before. And it's driving our providers absolutely crazy, from the individual provider all the way through the hospital provider, because it's incessant. It's so much so that they have turned to focus hiring on denials management. Denials management has always been a thing. It's really a thing now. She said, all I could hear was that line from Clarice Anthem by God, do it, don't do it, reconsider. Absolutely. Y'all know how I like to incorporate the songs in our in our Saturday morning tea. Absolutely. So yeah, that was crazy. And then the other thing, I don't know if I'm sure everybody in the world has heard about the killing of the CEO of United Healthcare, and some of the information that has come out as a result of that unfortunate she's laughing of that unfortunate action. Um, that happened on Wednesday morning. I was in a meeting, and all of a sudden my phone was just pinging, 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 and I'm like, what? And then yeah, it was just nonstop. But the crazy part, and we will definitely have more conversation around this on our meeting after the meeting. But from CNN, Tammy Luby and Claire Duffy reported about some of the things that they saw on a Facebook post by United Health Group expressing sadness about the United Healthcare CEO Brian Thompson's death. And it received over 62,000 reactions. 57,000 of those 62,000 were laughing emojis. So folks are not sympathetic at all. It says that they're still haven't determined at the date of this article the shooter's identity. But his wife stated that there had been some threats against her husband, potentially related to a lack of coverage. And she said she didn't know the details. Yeah, absolutely. They need to definitely hire, because even in this, they're talking about, yes. Even in this, they're talking about denials. And then they said two of the bullets at the scene had the words depose and delay. And I thought somebody said that there was also something that had deny on it as well. And police are exploring whether the words indicate a motive, since they are similar to the title of a book that's critical of the broader insurance industry called Delay, Deny, and Defend. Yeah, this was actually crazy. But then you saw shortly after in social media the backlash about how many people have also experienced social media is off the chain. Social media probably wins 99% of the time. It's you're like, what? Wait a minute, hold up. But they do get it in. Folks began just posting about their frustrations with not only United Healthcare, but other insurance companies where they have not received any care, or the denials of care, or all of those things. This one person said that United Healthcare, quote, denied my surgery 2 days before it was scheduled. I was in the hospital finance office in tears when I was supposed to be at the hospital doing pre-op stuff. Like, oh my goodness. And then they talked about how family have also been impacted by some of these things, especially surgeries being denied. They have, family coming in to see folks and flying in to see folks. They can't get that money back. They've spent time and money and resources to be there and help. Another person talked about how her breast cancer surgery was denied. And she was like, breast cancer. She asked me, well, is it an emergency? I don't know. It's cancer. What do you think? And so she had to actually appeal all of that in order to, she did get it approved, but after it had been appealed. And so, and I've heard this before, that it's a tactic of some insurance carriers that deny first. Oftentimes people they don't follow up with an appeal. Um, it's crazy. It's crazy. Oh wait, she said, y'all talking. Someone makes threats against my husband. I'm solving that mystery. I don't know what she's talking about. No details. I don't know. I don't know. And yes, you're right. Social media undefeated. They go all the way in. So um we'll be talking more about our thoughts related to um she said the authorization specialists also suck, by the way. That's a whole other thing too, that has been in the news of late, these prior authorizations. I know the AMA has taken up a big initiative to kind of highlight and bring information and education around prior authorization to the public. Um, I still hear all the time our managed care folks and friends over there are just running amok for whatever reason, and they're not following what they're supposed to do, allegedly. So it's a crazy game out here in healthcare. Um, you know, pockets are tighter, and folks are scrambling to make dollars out of 15 cents, and no one seems to understand that more than the patient. I'll say that. But we purchase a product. We purchase things in the event that we have it's insurance. Period. In the event that you may have to use it, it should be there for you to use. I guess that's my bottom line. If I'm paying these premiums, my employer is paying these premiums, me being an employer paying these premiums. I don't know. It's a crazy world out here in these American healthcare streets. And I've also heard, like, this may be an American problem. I'll say that. um oh wow. The AI UHC used was found to have a 90% error rate. Just imagine that. Oh, but everybody everybody wants AI, right? Right? And so that is a perfect segue into our topic for today, where we're talking let me stop the music and get rid of the banner. Where we're talking um kind of a continuation of our thoughts from last week, or last time. I'm sorry, we were off last week, weren't we? From last time, um, where we want to kind of take a look at some things we can do in our profession as uh, AI is on the forefront, and I wanted to focus in on AI ethics and um, what that looks like. So I do have my tea. I have a different blend today. I'm actually trying. I tried it yesterday and it was so good. Trader Joe's. Again, nobody sponsors um this, but our lovely PRN tea sippers and PRN. But Trader Joe's has an organic blood orange Rubios. Am I saying that right? Herbal tea blend. It is so good. And then I always have some sort of ginger and turmeric tea. So I have that. And then my yogi tea is I think it's a lemon ginger as well. And the quote on that says, appreciate yourself and honor your soul. Yes. Okay. So here we come. Let's spill the tea on all of these things. Oh my goodness. Okay, I'm reading the comments. They going off. Okay. UHC also trains their own coders to be CPC. Add that to the mix of FAFO. Yes, I do too. Sounds yummy. It is. I love ginger. Love, love, love it as well. Yes. Well, Well, I don't know. It's I don't know. We'll get more into that. I'll say that we'll get more into that. But anyway, so today let's talk about how we can be instrumental in changing some of the things in the world for our profession related to um, AI. And so I read this article, and the article is in the description of the video from it was from the Journal of AHEMA, and the article is written by John McCormack, and it's titled Artificial Intelligence More Likely to Transform HI Jobs Than Replace Workers. And in the body of the article, I ran across a term I had never seen before, ever in life. And it kind of stuck with me because again, we had already just talked about how to upskill some of the soft skills, including critical thinking skills. But then this opened up a whole other piece, and they added critical thinking skills in this article, but they also talked about ethical reasoning. And I was like, well, wait a minute. Wow. What is ethical reasoning? I had never heard that before. And so I figured if I hadn't heard it, somebody else hadn't heard it either. And so I said, let's talk a little bit about that. Um, so I wanted to put a poll up, and I don't know if this is going to work, but I'll place these questions in the chat. How about we'll do this? Um, that's how we'll do this. Okay. So, what's your biggest ethical challenge with AI in your daily work? And you can choose from. I hope it doesn't split. It's not too wordy. Oh, it did. Oh, wait. I spoke too soon. Oh, it did. Okay. A, balancing automation with accuracy. B, protecting patient privacy. C, managing AI human collaboration. Or D, maintaining data integrity. Okay, you quick on the keyboard, crafty coder. Quick on the keyboard. So you put in your biggest ethical challenge with AI in your daily work. Again, A, balancing automation with accuracy. B, protecting patient privacy. C, managing AI human collaboration. Or D, maintaining data integrity. I'd be interested to see your thoughts on that. Okay, okay, we got D, we got A. All right. So let's start with kind of the basics. So, ethical reasoning isn't just about knowing right from wrong, it's our professional compass in an increasingly complex healthcare world. So, in HIM, ethical reasoning, get it out, means carefully weighing decisions through three lenses. You're going to look through professional standards, you're going to look through regulatory requirements, and the patient well being. So, in a practical example, imagine you are reviewing. I'm reading y'all choices out here. Imagine you are reviewing an AI coded record that has assigned a higher paying code, upcoding, if you will. The documentation could support it, but it's in a gray area. And you know, we have plenty of gray areas in HIM coding. Your productivity metrics would benefit from letting it pass. What do you do? Hmm. So, this is where ethical reasoning kicks in. You need to consider coding guidance and compliance, any financial implications for all parties, the long term impact on data quality, and your professional integrity. And so the key is developing kind of a systematic approach to these particular decisions. So, thinking about that, the article again highlights that only 1.5% of jobs will be lost to AI but 6.9% will be transformed. And again, this transformation brings new ethical considerations to our doorstep. So, again, breaking down three key areas where ethical reasoning becomes crucial: um, autonomous coding review, data governance, and patient privacy. In autonomous coding review, couple of questions we would need to ask ourselves: when do we trust the AI? When do we override it? And how do we document our decisions? With data governance, who's responsible when AI makes mistakes? How do we maintain data integrity? I see that's a lot of the selections over here in the poll. And what's our ethical obligation to report AI errors? Mm. And then patient privacy. How do we ensure AI systems protect PHI? What new vulnerabilities do we need to consider? And how do we maintain transparency with patients? Hmm. All right, all right. Yeah, it's a lot. So, uh, unfortunately, I think, or fortunately or unfortunately, I'm still on the fence. But when we think about AI, we think two things. One, it's a tool to help us, and so we're trying to learn that tool. How can it help us? How is it beneficial for us? So that's one school of thought. And then you also have this school of thought of panic. Oh my God, what am I going to do? AI is going to take over my position, or I may have to transition into something different, or my position may change. And so we're reactionary, I guess, if you will, based on all of the information that is coming out to us. Again, I like to always be on the offense. And so, um, let's be proactive and think through a lot of different areas where AI in our profession may be impactful and help us. And again, we've kind of focused this little series on soft skills and what we need to know and do and have and going to into our profession, or going as we evolve in our profession during this time. So let's look at a practical application, if you will. So let's work through. I got a couple of case studies I guess we can talk about. Um, the first one is similar to what we had before. Um, you notice AI consistently upcodes certain procedures. This is across the board. The increased revenue hasn't been flagged by compliance. What's your ethical response? Again, this is coming from an ethical lens. Yes, it may not necessarily be your job to do, but you do have an ethical responsibility. Again, as we talked about ethical reasoning, putting into play um, your professional governance, your professional guidelines, ethics, all of those things. That's something you need to walk every day as you walk into your profession. So some analysis that you can do with this. One, verify that there is actual pattern. I mean, I know, we look for stuff, we we find little anomalies here and there, but make sure that there's an actual pattern of consistently upcoding procedures. Document the findings. Review the impact. Again, this may not be a one person. This is a conversation potentially with others in revenue cycle to assist, and possibly your IT folks as well, or those who are working with whatever AI y'all have layered over top of your revenue cycle. Also consider other stakeholders. Make sure that they are part of the conversations, and then develop an action plan. What do you do? How do you correct this going forward? And then make sure in that action plan there is education. To the folks. Folks need to know, we're changing this because da 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 da. And the reason why is because this guideline states this, that, and the third. There we talked about this, I think, in the other one, making sure that folks understand what they need to know while they need to know it. So, you have folks who will just take what you give them, do this, do this, do this, and they are the type of employee that will just do whatever it is. You also have those who are more inquisitive and they want to know, well, why, or what's the reason behind. And so be prepared for both types of workers and provide them the information that they need. Here's another case study: the privacy puzzle. An AI system flags a VIP patient's record for coding errors. Extra eyes on the chart increase privacy risks. How do you proceed? Some key considerations in this particular scenario: equal treatment principles, privacy protections, quality requirements, and of course, documentation standards. So those are a couple of things that you can think about as, these type of things come up. But again, you have to use your ethical lens. And so you have to build up um, your ethical toolkit, if you will, your ethical reasoning toolkit, if you will, as you navigate some of these things. So, uh, yeah. So here's some things that you can use into gathering or putting together your ethical reasoning toolkit. Um, Couple questions you need to ask: is it legal? Is it fair? Would I be comfortable if this decision made headlines? And does it align with professional standards? You also need to document your reasoning process. How is it that you are determining or deciding which way you go, especially if you are in the decision making position and the decision making role? Um, because you may be in a role today, but that policy that was implemented based on your information, based on your decision, may outlast you. And at some point there should be some reasoning behind it, like, well, we did this because at the time, this, that, and the third, da da da. Now it may have to change, it may have to be altered in the future. However, for the time that that policy was implemented or that policy was created, this was the reason behind that. So document your reasoning process, build your support network, and then always stay updated on any AI ethics guidelines. So um, remember that in the age of AI, our ethical reasoning isn't just a skill. It's really, it can be our superpower. This is again additional things that we have to upskill in the profession. It's happening to us. It's happening to us at a faster pace than we probably would like, because it's actually really here. But w- we're in a position where we can kind of get in front of it and do something about it, if you will. And particularly as it pertains to us individually. You could stay in the, oh, woe is me, what I'm gonna do, how I'm gonna do, should I leave the profession, da 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 da, boat. Or you can say, you know what, I see kind of what the writing on the wall is. I see that, we may get more, because and I've heard this said over and over again. The AI um, today is better than what it was yesterday. And so it's always improving because they have people working on it. They have people adding to it. They have people who are in the profession um, assisting them to make it better. Like I said, I went to AHEMA 24, and I want to say the majority of all of the vendors that, I mean, you had some education vendors, you had a HEMA, you have some compliance vendors, but the overwhelming majority was about AI, and what systems they use and how AI can help in generating or increasing revenue, or can help with productivity, or can help with your staffing shortage or can help with all of the things. And so it's here. Um, it's not a thing of, oh, it's coming. It's already here. And we've actually been using it for years, at least in the coding realm, where you have, the computer aided coding systems. Um, but again, the coder had to make decisions on that. They're not the ones to just automatically add it. Now, with this autonomous coding thing, this is a little different where it's bypassing you, if you will, and sending it straight out the door, sending it for reimbursement. So again, we really have to kind of prepare ourselves, upskill um, ourselves to be the best in this game for whatever comes. And today it's AI. Tomorrow it may be PI. I don't know. I'm just saying, today it's one thing, it can be something else tomorrow. And so we always have to kind of be on the swivel, making sure that we're preparing ourselves for what's coming in the future. Okay, let's see. So from our question from our poll, um we had a few with A, which was balancing automation with accuracy. We had several, we had a couple A's and a couple D's. So A was balancing automation with accuracy, and D was maintaining data integrity. Um, Dr. Jasmine also said accuracy. I used AI to find some notes about my sermon for tomorrow, and it was wrong. Absolutely. And you have to verify and validate what is happening with the AI. They teach you how to, and like I said, for those who are interested and have jumped head first in, well, let me be on top of this. Let me learn how to prompt. Let me learn how to get but there's still some additional work that has to be done. You can't just take what is spilled out and say, okay, this is it, run with it. No, you need to validate, because I've seen some AI things, and also remember that it's time delayed. So the information is only as accurate as to the date that whatever AI product you're using um, has. And so you have to make sure that you know what's or should know what's most current and what's happening out there. Yeah, she said it's a fine line between A and D for sure. Absolutely. Um, but you know what's current. AI may not, and so they may be giving you something that is outdated at best, but then absolutely wrong, because there's the thing of they call them hallucinations that they do. And so you need to make sure that you're reviewing the stuff that it may be spitting out for you, and you're the expert, not the computer. Again, someone is putting this information in. Somebody is it's pulling from things that it finds on the internet. Well, everybody may not necessarily know what they're talking about on the internet, and you don't know the sources from which they are pulling. And so they may, dig their teeth on one particular article or post or information that may be wrong, and has later found out this is wrong. One thing that I try to do when I use any type of AI product, and if I'm prompting, I give it something to focus. So it's not a broad, vast, oh, be out there, try to find me XYZ. No, I have something that I want you to assist me with. So if I'm looking at an article and I want a summary of this particular article, and then from there, I can say, okay, well, I like this, I like that, I like that. And then, continue to prompt to get whatever it is that I'm looking for. So it's an exercise. It's not a, oh, hit that one button and boom, everything I need is right there. Even using AI to create or for data analysis, and say you're creating visuals from that data. Again, sometimes you have to go in and retweak it. Sometimes it doesn't, the math is not mathing. It's a lot of things that you have to do. Yes, you are the expert. Absolutely. She said exactly. that's the major part to remember. You're the expert. Remember, AI, artificial, is in there for a reason. Absolutely. Seriously, AI and HIM will require us to maintain a level of competency in our profession and not totally depend on automation. The problem comes when we can't recognize what's wrong because we don't know it's wrong. Whoo, that's a word right there. That is a whole word. And that is the scary part because folks are just blindly following or taking up whatever it is that they see and standing 10 toes down on inaccuracies. And so that's yeah, that is also a problem. And we have subject matter experts. Use them. Ask them. They're there before you regurgitate or continue. It's like gossip. You're spreading something that is untrue or spreading something that is false, and it's continuing to trickle on and on and on and on, without anybody verifying and validating facts. Validate your facts, people. Validate your facts. It's like, yes, yes, validate your facts. um yeah, and don't let validate your facts. And remember, you are the expert. You know what you do every day. You know your job. You know your worth. You know all of those things. And yes, you may get some additional information that helps you um be better at your job, but okay, but you know your worth. You should know your worth. You should know your worth. And know what's right and what's wrong. And so, even going back to that, Dr. Jasmine, when folks don't know it's wrong, that's again part of critical thinking. Uh, this again, ethical reasoning, decision making. All of those types of soft skills that, unfortunately, it has been in my experience and what I've heard from employers that are lacking in people coming into our profession. And so at some point, I think it has been, and not necessarily a dig at those of us in the profession, because sometimes the only thing that is put in your face is production. Get this out the door. Get this out the door. It's a constant moving, these facilities and CFOs and all of the people, they're interested in the bottom line, which is the dollar. And unfortunately, depending on where you sit in that revenue cycle, you get caught up in that. I just got to make sure my numbers are right. I got to get all my numbers. I got to get my numbers without really thinking through and making sure, but is this right? Is this correct? And that's where you individual um, have some level of responsibility. Um, and and I know it's a constant fight, and I do feel my heart really does go out to some of you who are in those types of positions because it's crazy. It is crazy where you have so much that you have to get out, where you don't even have an opportunity to think through. Um, well, wait a minute. This I see this and it doesn't look right. We have our intuition and it will tell us, hey, something is not right here. And you don't even have enough time to be like, I let me put this aside or let me take a moment to just validate or look at that. But on this shoulder, but we got to move. We got to get them out. We got to get them out. And I that's a problem. And then the threat of, well, AI can do it better, or they can get it out faster, or they can do, all of those things that are looming over our heads as we do our job. It's so unfortunate. It's really, really so unfortunate. And I think, you know, again, in being proactive now is the time that, we do rally around our profession and um kind of talk through and share with others what it is that we do, what we come to the table with. And it's not about just pushing those numbers out. It's not just about production. Um, this is a skill, a science and an art. This is a skill that we come to the table with in order to make sure, because it's one thing to push it out and get paid. And we say this all the time, but it's something totally different to keep it. Yeah, you can get it, but can you keep it? And we want to make sure that our organizations are keeping um, the dollars that they're receiving based on documentation and the services that are being provided. It's a whole cycle. Let's see what she say. Oh, I know. I was not a coder for a long time, but I did work for the QIO when we did audits. I always had questions. You always do. And you need the time to kind of validate that. And it's crazy. They worry about the bottom line and can't code a lick of cases themselves. Absolutely. But that's what, unfortunately has been top of mind because of the financial situations that some of our organizations are in right now. And my thing is, and I've always said it, there's a guideline for it. There's guidance for a reason. Guidance tells you how to move. Now, yeah, we do have some rogue players in the guidelines, but somebody has to be responsible to say, okay, this is what they said they wanted. They needed to see this, that, and the third. Make sure we got what they want so we can get what we need and we can hold on to it. Period. It's a know how to play the game. Know the rules of the game. It's a whole big game out here. You need to know the rules of the game and how to play the game in order to be successful. Right? Right. All right. So again, I just wanted to kind of come on today and add to our skill set, if you will, um, in thinking about AI and AI ethics and how it relates to us individually. Making sure that we're doing what we need to do um, in this whole AI world, if you will, um, to not only benefit ourselves, but also benefit our organizations and benefit our professions. But at the bottom line, first and foremost, and most importantly, benefit our patients. Because really, we're at that intersection where what we do and how we move ultimately has an impact on a patient. It started with the patient, it's going to end with the patient. And making sure that we are um, doing the right things for our patients from an ethical perspective and an ethical lens that we all adhere to, whether whichever organization that you are that you belong to. There's always ethical considerations for those organizations. And if you subscribe and I'm 100% for my organization. I pay the money. I'm certified with them. I got education through them, whatever. You at that point have subscribed to making sure you're following the ethical guidelines for those organizations within our profession. All right. I think that's all I have for today. How was that? Was there tea spilled today? Did you take away anything? Again, for me, I just didn't know what ethical reasoning was. I said, "Oh, not that I had never done it, but never knew that there was a term that kind of encompassed all of the things that you do when you ask questions." And it's really about asking the questions. Um, One thing that I have added to our PRN sippers, I now have an area where you can kind of talk through and share some of any ethical challenges that you may have. And so, this is a dedicated space for ethical discussion. Um, that in our community forum area where yes we can just dialogue and say, wait a minute, what do you think about this, or how would you handle that? Again, communication, community is always a good thing. You can bounce different things off of each other, and so that's what we do there over in our um, PRN tea sippers community. All right. Yes, I see. There's some tea. There's some tea. Put your teacups up. Yay. Put your lighters up. Shine a light on them. Hey. Put the teacup on them. Yay. Yay. All right. All right. All right. Well, I hope this was helpful for you. Again, I hope this is something that you can walk away with um, and apply it to your day, as especially as we're going through all of the things in AI. Don't be afraid of the change. We and no matter how long you've been in this profession, I'm sure um, someone has told you that everything changes. Nothing stays the same. We're in a profession that is constantly evolving and constantly changing. Um, and so don't be afraid, but know that there will be differences, there will be changes, and jump in and learn. She said, Dr. Jasmine says, yes, use AI, um, trust but verify. She's the rapper for real. She's a poet. She probably did know it. I was gonna say a poet didn't know it, but I'm sure she did know it. Use AI. Trust but verify. Absolutely, absolutely. I love it. I love it. Ah, absolutely. I love that too. We have to be the change we want to see. Yes, we do. Yes, we do. Always. Always. All right, y'all. Well, let me put my ending little slide up here. Yay. Okay. So, thirsty for fresh perspectives on the healthcare revenue cycle? Well, by becoming one of the PRNT sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can seep in knowledge together? Come, let's spill the tea on industry insights. Here's what you can expect as a valued member of the PRNT Sippers. Exclusive healthcare insights, gain access to in depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access, be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry. Personalized support, enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And my favorite, community connection. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So, by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So, thank you for considering becoming a member of the Tea Sippers. For the cost of 2 cups of tea or one of those cups of coffee, you can join the community. Check out the link in the description of the video. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. Yes. Oh, I see the teacup. Hey, hey. Yes, she keeps a dope rhyme, don't she? Yes, she does. Yes, she does. All right, y'all. Well, again, thank you all for joining the Saturday morning tea or checking out the replay. Again, I see the teacups in the chat. We're doing the things. We're doing the things. And if you have questions or thoughts or experiences that you want to share about today's topic, we'd love to hear from you. So you can continue to drop comments in the video. And let's keep the conversation brewing. I check the comments regularly. I get a ping and I'll say, oh, somebody's come in with a question or someone's come in with a comment. And so I am constantly checking them because I get pinged. I get notified for them. And if you enjoyed this episode, please give us a thumbs up. It helps more healthcare professionals find our content. Also, the check us out on Instagram, I think Professional Reimbursement Network or PRN Coding EDU. We over there on Instagram. Um, we out there on Facebook. We're a little bit everywhere, but primarily we're here on the tube. We're here on the tube. Remember, at the Saturday Morning Tea, we're all about building a community of savvy, informed healthcare professionals. So, again, like, share, subscribe, and comment, and let's grow this community together. Yay. Okay. Well, we are at the top of the hour. Look, right on time, just about. So, this has been a great session today. See you tea sippers at 10:15 a.m. I'll make sure that the link is there available for you. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care.